My name is Kathy Davis. I was diagnosed as a pre-diabetic in 2009. 4 pills a day. I would take 2 in the morning, 2 at night. So I think that's really what made me say, I can't do this for the rest of my life. I joined the Y, started working out.
The latest numbers from the CDC show that we have now over 29 million people in the United States with diabetes. But the real gorilla in the room is the 86 million people with prediabetes. And the health impact in this country is amazing. And we have evidence that if we do lifestyle intervention early, before they actually cross that threshold into diabetes, we can actually markedly reduce the rate with which they develop diabetes and maybe even in some cases eliminate it.
The Y continues to lead the charge around prevention and specifically around the issue of diabetes and prediabetes.
The YMCA's Diabetes Prevention Program is a lifestyle modification program for adults who are at risk of developing type 2 diabetes. For the first 16 weeks, participants will meet in a group setting with a trained lifestyle coach on a weekly basis for 1 hour. At the beginning of each session, there will be a weigh-in where we track weight and physical activity during the whole year.
There's nothing like patients helping patients. That group dynamic that helps feed motivation, socialization, and makes them want to be a part of something special.
When I saw the diabetes prevention, and I'm like, oh my gosh, I could be a coach for that. I lived it every day. I was already a pre-diabetic before the program started.
The vast majority of people need to relearn how to eat, how to be active.
It is very powerful information on how to balance and maintain physical activity and eating healthy.
I mean, they need that kind of guidance and structure to be able to achieve those results. It's just not going to happen by itself. The YMCA is in almost every community in the United States, so it makes sense to use the YMCA as a vehicle for the diabetes prevention program for our patients. And I think it's important for primary care physicians to prescribe that.
The Y also is one that continues to raise funds and give charitable contributions to those that can't afford the program. But it's going to take more than the Y in order to be able to do this. So we are actively seeking other stakeholders in the community that have the ability to partner with us.
We need all hands on deck. We need the primary care providers, we need the third-party payers, we need the government, we need everybody to recognize the cost-effectiveness of a lifestyle intervention that has evidence-based that it actually works.
Now I'm more active, I'm more conscious about what I eat.
And what we've seen is when they go through this lifestyle intervention, they tend to maintain that reduction in the progression to diabetes years after the intervention.
I've lost about 40 pounds altogether. Every time I've gone back to the doctor, like in December I got a good report, and yesterday I went to the doctor and I got an even better report.
It could be their lifesaver, and it could be that one thing that they've been looking for so long that helps them create sustainable changes that they haven't been able to make.
So it's really a no-brainer in my mind that we do this as a community of people taking care of patients.
I feel like as we move into the future that the readiness is there, and I'm excited for all of us to join around this so that we can now reduce this burden of diabetes and prediabetes, and we can impact the future generation.
I'm glad I went through this program. It's not a quick fix, it's a journey.